Welcome to the fourth in our series of podcasts on vaccine hesitancy. My name is Tom Sorell. I'm professor at the University of Warwick. Today, our subject is the connection between vaccine hesitancy and disinformation, online disinformation. Um, it's widely known that both vaccine skepticism and vaccine hesitancy are helped along by disinformation, but the mechanics of the spread of disinformation are a specialist subject. Today, we're very lucky to have with us two specialists in the mechanics of disinformation, Henry Tuck and Aoife Gallagher from the Institute of Strategic Dialogue. Henry, could you start by introducing yourself, and we'll go to Aoife after you.
Hi, I'm Henry Tuck. I'm the head of digital policy at ISD. I lead our research and policy work on the regulation of internet platforms.
And Aoife?
Yeah, so my name is Aoife Gallagher and I am an analyst at the Institute for Strategic Dialogue, and I look at the intersection between extremism, conspiracy theories and disinformation online.
So in this project, we're interested in the rationality of vaccine hesitancy, how to make sense of it. And then, we talk about, its philosophical justifiability or its moral justifiability, I suppose, is the way that we approach it, whether it's ever right to hesitate to cooperate with a vaccine program that's got a lot of scientific confirmation. So we know that people become hesitant through exposure to disinformation and misinformation in general. The first question that we have is, what counts as having been influenced by a piece of disinformation or misinformation? Is simply liking something that one encounters a sufficient indicator of having been influenced?
So from a research perspective, likes are generally considered quite a weak signal or indicator of user engagement with content. They'd be stronger than an impression or a view. So an impression would be when a piece of content sort of shows up on someone's screen, but it doesn't necessarily mean that they've engaged with it. But overall, likes would be considered sort of less valuable than a comment, a share, or a retweet, or other more sort of active user responses. But all of those types of metrics don't tell us a huge amount about the true impact or influence of online content on sort of user attitudes or behaviors. Overall, I think you'd need a more qualitative analysis of comments and other reactions that would help us kind of get a little bit closer. But even then, they're not necessarily going to get you all the way to kind of a really reliable picture of deeper, more long-term attitudinal or behavioral change, especially on a more individual level. Social media platforms themselves will have kind of a more holistic access to data than outside researchers will. So they have a good understanding of kind of which users are exposed to which types of content, how often, and they're also able to form a broader, kind of more nuanced picture of user activity and how it evolves over time. So, for example, kind of which other accounts, types of content, or online networks or communities a user engages with, having sort of been exposed to a certain piece of content or types of content. They're able to see in more detail kind of what a user does having been exposed to certain content. So I think, again, to go back to sort of research perspective, to understand sort of influence in a more deep way, I think researchers or outside researchers would need to look at sort of user behavior across multiple platforms, and also consider kind of offline influences as well. So potential sort of offline social networks or influences, the impact of other forms of media. We still see things like broadcast being particularly influential, even if consumed online, and also kind of use a mixed methods approach alongside digital and online data analysis, sort of thinking about things such as polling, interviews, focus groups, more sort of offline and face-to-face methods as well.
Just to follow up a little bit, take the phenomenon of retweeting. Wouldn't it be possible that somebody would retweet something and simply be thinking to themselves, "This is ridiculous. Get a load of this," and send it to a bunch of friends who might be like,
yeah, and I think that's why the sort of qualitative element is really important, because all of those different types of metrics can be used in sort of different ways. Some people might use a like as a sort of bookmark to just log that they've seen a piece of content and be able to go back to it and find it more easily. As you said, retweets can be both sort of positive or negative. The dynamics on a lot of social media platforms mean that there's some quite, people like to kind of criticize others or sort of mock others' views, things like that. So retweets, shares, whatever it might be across different platforms, I think you need to look beyond the sort of pure numbers and see sort of what the context for that is.
And again, another little follow-up. When you say that social media companies hold a lot more nuanced information about different interactions between users of their platforms and, I guess, influence, they hold it in the sense that algorithms are directing them to algorithms a direct collection of different kinds of data, right? But are there people in social media who are consciously monitoring what's going on in relation to users and, say, vaccine disinformation?
Yeah, I mean, certainly not on a sort of individual level, but as an aggregate, companies definitely have an interest in sort of what users are engaging with, what types of content are proving most sort of successful in a sort of purely quantitative sense rather than as a sort of in an influencing context. And that's sort of fundamental to their business model, right? Like as users, they are selling your attention to advertisers, which is where their sort of financial power comes from. So yeah, the companies are sort of designed to understand in a really deep way what is sort of happening on a platform and understanding sort of connections between different types of user behavior. If a user consumes X or likes Y, what does that then lead them to do in the future?
Good. Aoife, vaccine-sceptical people, as opposed to vaccine-hesitant people, are they typically believers in conspiracy theories in general?
I think a good way to answer this is to kind of, point out the fact that there's a difference between hesitancy and skepticism and being anti-vaccine. And I would argue that the difference really that kind of pulls people to the extremes of anti-vaccine beliefs is a belief in conspiracy theories. So obviously there's a lot of different reasons for, and very genuine reasons a lot of the time, for being hesitant or skeptical of vaccines, from, a fear of needles to worries about side effects to levels of trust in manufacturers. And then that also depends on the geographies that you're talking about. Different parts of the world will have different kind of, reasons for being hesitant or skeptical of vaccines. For example, kind of middle class and upper class societies in the Western world have kind of been, in the past few years, kind of suffering from complacency around vaccines. So it's not exactly, it's kind of built around the fact that, kind of these societies haven't had to see the impact of vaccine preventable diseases for decades now, so the kind of typical thing that you might hear is, well, why would I bother getting vaccinated against a disease that's no longer an issue, or get your child vaccinated? Do you know what I mean? Whereas in sub-Saharan Africa, they're still kind of faced with the realities of this. So there's kind of different, it is very nuanced across different geographies as well. So I think that's the first point to make, is that vaccine hesitancy is complicated, and there are many reasons for people to be hesitant of vaccines. And people that are hesitant or skeptical are probably more likely to be persuaded to get vaccines when they're presented with the correct information, but they are also more susceptible to the narratives of the anti-vaccine movement. So anti-vaccine, then, speaking about the kind of anti-vaccine beliefs, is, I would argue, a more dogmatic position than being hesitant or skeptical. And people who buy into anti-vaccine narratives have often been persuaded that vaccines are inherently dangerous. And typically they've been persuaded because of a belief in conspiratorial narratives. So that can be claims that vaccines are a depopulation tool, created by the elites of the world to deal with overpopulation, or claims that pharmaceutical companies are hiding the real risks of vaccines in order to profit from them, whatever that type of narrative is. So yeah, that would be kind of the way I'd look at it, is that, people that are hesitant may not necessarily believe in the conspiracy theories, but they are susceptible to those narratives. And it depends kind of where they get, where they source the answers to their hesitancy, if they're going to be pushed into kind of more extreme anti-vaccine rhetoric, or if they kind of, get decent information from, say, a healthcare professional, it's able to kind of alleviate that hesitancy in them.
I mean, in the project, we're interested maybe not in every kind of vaccine hesitancy, but we do draw distinctions, and I just wanted to see what you thought about some of these. So we could take the difference between, an established vaccine like MMR, which has been subject to skepticism in the past, measles, mumps, and rubella, an established vaccine. We can consider skepticism about that, which started through a piece of misinformation in the Lancet, in a respected medical journal, in, I guess, a long time ago, in the early 1990s, and then the COVID vaccine. I mean, where the COVID vaccines are a subject of national conversation, repeated national attention. There's a lot of official attention about it that, at least intuitively, would probably dominate, news in general. When do you think of a difference between skepticism or anti-vax attitudes in relation to COVID, the dominant news story of the day over months, and vaccine skepticism in the MMR case? What do you think of the differences there?
Yeah, I think there definitely are differences to that, right? I mean, the MMR vaccine is obviously very well established, and that, and as you say, the skepticism that comes from that was kind of a lot of the breeding ground for the modern anti-vaccine movement in general. So I think that if you look at the COVID vaccines, I think there's a lot of, as I say, I think, going back to, say, the end of 2020, there were a lot of very genuine reasons for that hesitancy. And even, a personal anecdote, for example, I was speaking to my cousin, who was a doctor at the time, and she even said to me, she was like, I'm still a little bit kind of conscious of the fact that, this has happened very quickly. And she was like, I need to do a bit more reading into this. And she's a doctor. Do you know what I mean? So there were very real and genuine reasons there, I think, to be hesitant of that. Whereas the MMR vaccine, there is so much evidence to prove that is true at this stage, and kind of it increases all the time with the more the more that's kind of added to that body of evidence. So I think that, you definitely have to differentiate between different things like that in the different situations that people are exposed to information about those vaccines.
Maybe we can move the discussion a little bit to the connection between people who might be vaccine hesitant on the basis of misinformation, or even vaccine skeptical, or even anti-vax on the basis of this information, disinformation, and maybe connect the phenomenon with belief in conspiracy theories in general, not related to vaccines. For example, in a recent podcast, an American podcast that's called Now We Are Three, somebody talks about the way that their brother was seduced by general conspiracy theories about the way power was wielded in the United States into thinking that the vaccine was an instrument for general social control. And when he spoke to his own sister and to other people, and tried to defend his anti-vax views in that case, he sort of said things like, when he was being urged to take the vaccine, he said things like, "You fell for that." I wouldn't fall for that. Is that kind of self-image? We find this very curious. Is that sort of self-image of, we're not gullible. We're not gullible the way most people are. We're particularly self-critical. We're particularly critical in general, and questioning in general. Do you think that sort of self-image is typical of people who are vaccine skeptical and maybe sometimes vaccine hesitant?
I think there's, again, I would kind of stress the difference there between the hesitancy and the kind of dogmatic anti-vaccine beliefs. And I think there's a point to be made there about the way conspiracy theories tend to have this kind of snowballing effect. So if you believe in one, you're kind of more likely to believe in others, right? And kind of develop almost a conspiratorial worldview. So that's kind of the way that you see the world, is in a conspiratorial mindset, right? But and this is kind of from me chatting to psychologists actually about the kind of nature of conspiratorial belief. And what they've kind of told me is that people tend to embrace conspiracy theories when certain needs in their life, psychological needs in their life, are not being met, right? So the need to feel safe and secure in the world that you live in, the need to know what's going on, and the need to feel good in your social circles. And I think this is the one that you're kind of trying to hit on here, is the need to feel good about yourself, and to feel like you belong in certain social groups and feel good about that. And I think that what conspiracy theories tend to do is, number one, they give people very simple answers to very complex situations, and our brain really likes very simple answers, right? Just in general, and they also give people this sense of superiority, that they know what's going on and that other people are essentially being led like sheep by the mainstream. So I think that sense of, it's almost like a contrarianism, like that, this built-in contrarianism to constantly not believe in what you're told, or the idea that nothing is as it seems, which is a very inherent part of the conspiratorial mindset. So if if someone who has developed this conspiratorial worldview reads a news article, they will not believe what the news article has told them. They will immediately look at the news article and go, well, what does this actually mean? So they'll constantly be trying to find another reason behind it. And similarly, kind of a similar point, I suppose, is that conspiracy theorists tend to think of themselves as critical thinkers, that they have a higher level of critical thinking than the average person. But what this normally is again, that contrarianism. That's just kind of blanket rejection of anything that is mainstream.
I was wondering what your reaction is to something that we've encountered, which is this. When people are talking about being vaccine skeptical or vaccine hesitant, they sometimes say things like, I've done the research. But what they mean by research is Googling something and then following a lot of Google links from one place to another, which doesn't count as research in any university, for example. And I'm just wondering whether you have any sort of views about the criteria for research, or the criteria for thinking that views that conspiratorial folks believe are well grounded because they've been based on research.
That idea of doing your own research is, again, a very empowering thing. I think if you say to anyone, and I think, there's always that grain of truth there. The internet is this unbelievable tool that if you have the right capabilities, you can do your own research on whatever kind of subject matter it is, right? But I think, and especially talking about things like vaccines and anything to do with kind of science and healthcare, right? There is a general kind of misunderstanding between the general public and people who are scientists and researchers and do this for a living. And one of the I think one of the main pitfalls that people fall into when they're doing their own research online is cherry picking. It's kind of the very kind of core elements of science denial, is that you can go onto a search engine like PubMed and you can put in, a couple of keywords and you'll find one, paper that's kind of proves the point of what you're trying to make, but that is not actually how scientific research is conducted. And it's all, based on, a body of evidence that's proves something to a certain level of certainty, but never to absolute certainty. Do you know what I mean? And I think that that there's just that level of like the general public would not really understand that it takes so much more to be able to actually prove a certain point in some kind of scientific research. But the online world has created the perfect kind of opportunity for people to be able to do that. And they're also kind of probably encountering, when they go into these kind of communities online, they're kind of encountering, the typical kind of echo chamber effect where people are kind of told that, they're right about things. And again, that's also a very empowering kind of a thing to kind of be told that you're right about your beliefs.
Yeah, I think this brings us to a question we wanted to put to you, Henry. oftentimes in other sorts of cases where people are spreading disinformation or sometimes just very far out views, they're banned from one platform, one social media platform, but driven to another that presents itself because it welcomes these even more radical views. Um, I wonder whether you have some views about, what can be done about disinformation in view of the fact that there are these receptive, smaller echo chambers around that people can move to.
Yeah, so I think sort of research is mixed on whether, or for other types of online harm, so for example, extremism and radicalization. And I'm not sure we really have a sort of clear answer on whether it's better to have sort of things more out in the open, where they can be countered, where you can kind of more easily keep track of how communities and narratives are evolving, or whether it's better to kind of quarantine those types of communities in smaller spaces. But obviously, then you kind of run the risk of them intensifying and sort of losing that ability for alternative views or kind of competing perspectives. So I think it's kind of this trade-off between widespread exposure and on more mainstream platforms and kind of more intensity on smaller platforms where often you have less moderation, less conflicting information, but also increasingly, I think, sort of connections and proximity with other types of harmful content or communities. So this is something that we've seen over the past few years. People might start as a vaccine skeptic. They may then sort of move into the anti-vaxx space. They then may get banned on a mainstream platform and move to a smaller platform. And you find that those sort of anti-vaxx conversations are happening alongside, groups kind of having or groups that hold far-right views or other kind of forms of conspiracy. And so you end up with this sort of a la carte menu where people come for one thing, but then end up kind of consuming other forms of harmful content as well. But at the moment, I don't think we have a sort of strong enough evidence base to really make a sort of judgment over which scenario is better. I think my personal view is that it's probably preferable for things to be kind of quarantined, and to not expose those types of sort of harmful communities or harmful content to people that aren't sort of explicitly seeking them out. I think, again, to go back to a kind of radicalization context, I think we've seen that when either sort of far right or extreme Islamist groups are present on mainstream platforms, you find more and more people kind of experimenting at least with those types of content and sort of getting sucked in and then maybe drawn onto other platforms via that more sort of mainstream space. So we also don't really have a clear sort of sense of cause and effect. So I think while it's my view that it's probably better to quarantine, I don't think we sort of have the ability yet to accurately sort of tie that to real world outcomes. But yeah, my sense would be it's probably better to keep these things a little bit more kind of hidden away. But I think it's also worth saying that, harmful online communities of all different stripes can act differently in different online spaces and to different audiences. So to, again, use a sort of extremism parallel, an extremist influencer might say something very different on a Facebook, YouTube, or Twitter than they would do on a kind of smaller platform. And they're trying to kind of entice people in with what seems on the surface like a sort of relatively acceptable position. But they're then getting sort of drawn down into online spaces where they're a bit more honest, let's say, and are kind of a bit more open about their real views.
Good. We wanted to ask about another kind of online space that seems to complement, conspiratorial content, and that's private spaces where people who are being persuaded to join in conspiratorial beliefs can be, so to speak, worked on more privately, more perhaps personally, by either conspirators or, in the case you mentioned, for extremist purposes, where a kind of grooming might take place. Do you see any of that kind of phenomenon? The movement from a public online space to a private online space for the purpose of influencing folks in the kind of vaccine area?
Yeah, I think so. And I think it sort of runs in parallel to, increased enforcement or sort of increased, I guess, broader sort of social criticism. As a sort of viewpoint or a community gets sort of ostracized, they're more likely to sort of seek out more private or closed spaces online where they're not constantly getting criticized or mocked or moderated by the platform. So yeah, I think it's a pretty common sort of trajectory that you see across all sorts of different forms of online harm, and also sort of you mentioned grooming. I think that's another area where it might start in a more sort of open or public space, but will then sort of move into a more private setting. But I think it's also important to stress that I think that sort of public-private isn't really a binary. It's more of a spectrum. You have a range of different sort of online spaces, some of which are very public. So a platform like Twitter, where sort of accepting direct messages, all content is pretty much public, through to sort of a platform like Facebook, where you've got a bit of a mix. You can post publicly, you can have private groups, you can private message, all the way through to sort of more messaging focused platforms like WhatsApp or Signal. But a lot of platforms, have that kind of mix of both some more public, some more private spaces. And I think Telegram is a really interesting example here of sort of that combination where they have what are technically private spaces, so channels or groups. They can be sort of designated as private, and that has implications for how the platform moderates those spaces. Often they just don't really take any action on content or activity in private spaces. But those can have thousands or tens of thousands of members, and sort of no real barriers to joining. So sort of from a settings perspective on the platform, they are classed as private, but I think in practice and the way they're used, they're essentially quite big public spaces. And similarly on sort of messaging platforms as well, WhatsApp has a limit of 254 users in a chat. But, I think a lot of WhatsApp groups with that many people, I suspect a lot of them don't necessarily know everyone who's in that same chat. So it's a little bit different from, a one-to-one message or a small group message between friends. So I think it's important to sort of recognize that spectrum and think carefully about what types of actions and responses we want to take in those different settings, because we also don't want to undermine sort of privacy, anonymity, encryption, which are important sort of parts of online communication, and there's very good reasons for protecting those.
Great. Okay, I wanted to thank you both for a very illuminating and interesting conversation. Thanks a lot.